Hello, assalamu alaikum everyone. Thank you so much for joining this webinar. I'm happy that you guys are on. My name is Dr. Adil Manzoor. I'm Jersey raised, trained, went to med school in South Jersey, trained at Newark Bethesda Medical Center, and I've trained at as an internal medicine and pediatric physician. I've been in the front lines taking care of patients with COVID since the beginning. I worked at urgent care. Currently, I work at a emergency room where I take care of pediatric patients, adult patients, and also work inside a hospital. I also have my medical practice. So, quite a bit of patients I've seen, taking care of quite a few COVID patients, and definitely wanted to, share a lot of important information, especially with Ramadan coming up and the mosques opening. So, um, starting with COVID, I think a lot of us are already aware of how COVID spreads.
Hey, Dr. Manzoor, is it
Yes,
okay if we just wait a few more minutes in case other people join a little late?
sure. We can do that. That's not an issue at all.
Okay, thank you.
Meanwhile, Zen, you can ask some question because I'm sure people gonna be on YouTube too as well.
Seems like instead of more people joining, one person left. So hold on one second.
Yeah, we have to start on time. We cannot delay.
Yeah. Okay,
so why don't we just
we'll
get started? Go ahead.
Okay, perfect. So, I introduced myself already. So I want to go ahead and do a quick review on COVID. I think a lot of us already know that COVID, it definitely spreads and it has the ability and potential to spread exponentially. The biggest thing to keep in mind, COVID is definitely a droplet transmission. And one of the big reasons, we wear masks and socially distance is this big thing, right? A lot of us, when we cough, when we sneeze, the droplets can come out from our nose or mouth, and their ability to travel up to further than 6 feet or at 6 feet is what limits them, where the guidelines come from, right? So when you cough and you sneeze, and sneezing a little bit different, but when you're coughing, the droplets, because of their size, they can't get further than 6 feet. So one of the reasons we push for, stay 6 feet just in case someone has COVID and they're coughing. The chance of those droplets getting to you, into your nose and your mouth, and cause infection are limited. But there is some data that states that it can be airborne. Airborne essentially means it can go, quote, much further than 6 feet, but that data is limited, and we're definitely convinced that it's definitely droplet transmission when it comes to COVID. The big thing, as to talk about and to keep an eye out on with COVID, one of the things that I know a lot of people do not address, believe it or not only, is it spread through contact, but, it can be spread through stool, blood, and ocular secretions. COVID and isn't the first time we've had this coronavirus. We've definitely had several coronaviruses, and there's about 6 at this time. The first coronavirus ever introduced to the US was in 2003. And it's actually very common as a pediatrician when I'm in the emergency room for me to see other coronaviruses. Just last night, I diagnosed a child with a different coronavirus, 12-month-old, who had different type of symptoms. But the biggest symptoms they cause is diarrhea. One of the reasons, they ask you vomiting, diarrhea, fever, and stool plays a really big role in its spreading. So that's why one of the big reasons you should be definitely washing your hands. There's some data that it can survive in stool for much longer than the existing time. It can last for up to more than 5-6 days or so. So very important to make sure that hand hygiene is very big with COVID. And the other big thing you want to keep in mind when it comes to indoors, there's definitely research that's already confirmed that, the spread is very high. And, this classrooms, indoor mosques, indoor settings, homes, etc. And the biggest thing is the amount of time you spend with someone, and the closer you are to them increases your risk of developing COVID. When you go to the CDC and check their guidelines out, they specify, in order for you to be at high risk or very high risk, you must be, close to, within 6 feet of someone, not wearing a mask, for more than or up to 15 minutes, right? However, the way we end up catching it, if we're not next to someone for 15 minutes, is on surfaces, right? I think if you look up online, the number of times we touch our face, and last time I checked, is like over 8, like depends on the age group and whatnot, but it's quite a large number of times we touch our face. So when you're touching surfaces, you're shaking other people's hands, you're touching clothes, etc. A lot of us touch our faces without being aware. So that in itself plays that big role in COVID spreading. There are strategies in place that are based purely on science.
Let me listen to this Zoom. I'm gonna call you back.
That are based on science that can help prevent the spread of COVID up to 0%, or rather close to 100% COVID protection. And that's something I'm definitely going to address
I'm gonna call you back, Forrest.
this conversation. So, the other big thing, this is breaking down COVID, right? Making it very simple, right? If no one with COVID is around, chance of spread is obviously 0% or close to 0%, right? If particles are prevented from spreading, then the spread is very low, right? So, if two people are wearing appropriate masks, if one person's wearing a mask and the other person wears a mask, and you're coughing, and say you're within 6 feet, even closer, the chance of you catching COVID, if both people are wearing the right mask, that's very important. The mask has to be a certain method, it has to be a double layer cloth mask, not just any mask. Then the chance of catching it, you can look up, is less than 3% or so. So, particles being prevented from spreading, the droplet that we talked about earlier, definitely limits it. That's why masks are very important. And of course, sanitization is key. COVID can survive on surfaces for quite a few time, including your hands, which I'll address in a couple of slides, and the amount of time it can spread. So that's why it's very important that we're consistently, I say every 30 minutes or so to an hour, depending on how busy the location is, wiping down surfaces, especially surfaces that are high utilization surfaces. So, the toolbox that, we offer during Ramadan, 9-step process, when broken down, very simple and straightforward. The key thing you have to have is you have to have COVID testing. That's so important. And there's a reason the government has pushed for it. COVID testing plays a really big role, and we all know this. And that's because based on CDC data that we have, some say 35 to 39%, but, there's pretty good data showing that 59% of people with COVID can be asymptomatic, up to 59. So testing is super important. The other thing is, we call something called social bubbles, which I'll talk about in a few slides. The other thing you have to have is, in case someone is exposed, you have to have contact tracing. Contact tracing sounds so difficult. Oh man, contact tracing. How are we going to trace and, keep track of people in the community? When you combine our method here, it's actually going to be very simple, very straightforward. And there's a way to even automate it, where you can easily find people within your community, for example, within the masjid, that are part of certain social bubbles that I'll address, and be able to, guide them appropriately. Of course, masking and health automation checks is very important. The other thing is traffic pattern. Traffic pattern means, like, if you are going in the mosque, right? It's to make sure that certain areas are utilized, and we're only going to, for example, going for prayer, trying to limit the amount of people go in that area. So you want to specify which ways to go. So if you go into stores nowadays, especially like the big stores, you'll notice that there's a lot of arrows you're supposed to follow. It's supposed to be a one-way thing. That actually does play a big role in preventing COVID. Of course, social distancing is key. And next thing is sanitation protocol. So all mosques should have a specific sanitation protocol and have a system set up to make sure that you are constantly and consistently cleaning. And lastly, the last two, you want to have a COVID coordination team with simple and very clear communications. And of course, the biggest thing is COVID-19 vaccinations. You should be encouraging those. And I'll address towards the end why we should all be getting vaccinated. right? The CDC modeling does state about 59% of transmission can be attributed to individuals without symptoms. That's so PCR tests, and we're not going to get into the efficacy of these tests, but I can tell you, as a physician with a background in cell biology and neuroscience, the PCR test is the way to go, and that is the only test that should be reliable when it comes to picking up COVID, especially in asymptomatic people. The rapid tests, depending on the test it is, can miss COVID, and especially the asymptomatics, even the symptomatics, quite a bit of the time. In the world of medicine, we say anything, and it depends, what specialty you're in. But when it comes to antibiotics, for example, any bacteria with more than 7% resistance, we don't use the, we call it is resistant. We don't want to use it because 7% is a big number, right? In the world of medicine, we don't want any human beings to be affected. So when you have rapid tests that can miss up to COVID 25% of the time, that can be problematic. However, if they're paired with a physician with appropriate history, background, etc., then rapid tests do have a means of utilizing and helping prevent transmission. But ultimately, I believe the PCR testing is the way to go, and the way to do it. You should definitely have testing before opening the area, the mosques, right? And these tests should absolutely be for that work at the mosque. They should definitely, well, they come often, they should definitely be the ones getting tested, and have a system set up where you do weekly or bi-weekly tested for PCR for the COVID system. And when it comes to large gatherings, events and activities, you also want to test as many people as possible. That in itself together will help control spread of COVID. Next thing, social bubbles, right? We talked about it. The way you think of social bubbles, or think of like tiny communities, right, within your mosque. So I would say have certain parts of your community where the people that are always interacting with each other are the ones that are always staying together. Like, for example, when it comes to prayer time, when it comes to, for example, if you have an event with food or Ramadan, etc., however you do it, you should have these small bubbles, is what we're calling them. And try to limit it to under 40 people. The more bubbles, the better. But of course, it all depends on the size of the masjid or the mosque, or that organization you're at. But the importance of that is when you have these bubbles, what it does is these people that are close to each other, there are only a certain number of people. And if any of them, for example, test positive, then you're able to communicate, exactly who in that bubble can have potential exposure. And that's like a way to contact trace, right? It's knowing who's where and what they're doing. And if someone tests positive, you're able to quickly contact the others and let them know. So that's very important. The last thing you want is for people to mix. And I can tell you this right now. Actually, I don't have to. Watch News 12, right? Schools are opening, and the number of cases that are going up, it's just getting started. People think, oh, we're going to have a little bit of cases and then, no cases. No. The schools that have had almost no cases, they're the ones that have a very good system that is similar to what we have set up here. A lot of the public schools that are opening just randomly, and we don't want the mosques to open like this. And if you have kids, this, they're shutting down for extended periods of time. We're putting a lot of kids in quarantine, kind of kills the purpose of schools opening up again. It's just, in my opinion, the plan is just not set right, and they're just opening, and you don't want to do that during Ramadan, right? Because if you open, without a good understanding of, without a good system, you're going to expose everyone. If you have to quarantine, the CDC says, depending, or certain situation, up to 10 days, but to be really safe, you're going to have to shut the mosque down for 2 weeks, right? And that's half the month of Ramadan. You don't want to do that, right? So you want to be very careful in how to do it. And it's doable if you follow these steps, and this is not something it's made up. My team and I, that consists of Zain Ali and others, we've done quite a bit of research with active organizations that have opened up, that have shown that the COVID transmission is close to 0%, or you have more than 100%, close to 100% COVID protection. The next thing is contact tracing automation. I think I just discussed it already, right? So if you know what people are in which bubbles, if there's someone that is exposed, you just reach out to that group, whether it's email, whether it's phone call, whether it's text message, whatever your community is able to utilize, you can definitely go ahead and do that. And so by doing that, you don't have to limit people from coming in. If you can have multiple bubbles, you can have multiple people of different you have to you don't have to be like, oh, mosques are only allowed to have like 20 or 30 people in at a time. No, if you have certain bubbles with appropriate social distancing and appropriate system setup, depending on the size of the mosque, you can definitely have more and more people coming in. The other big thing, I think that's important, you should definitely have some sort of system set up at the door. Yes, at the door. That's important because a lot of people wear masks and they don't wear them correctly. When you wear a mask, it has to be above your nose. It shouldn't be below your nose because then COVID can definitely spread, right? So you should have someone that's at the door making sure the masks are put on appropriately. If they're not, especially with the kids, that they are put on appropriately. And if they're not put on appropriately, and if the child cannot put the mask on appropriately, then that person should not be allowed in the mosque because they're at risk of transmission. And children, that's another story. Are definitely harbors of having the virus and spreading, and they fall into that big category of asymptomatics. And of course, I think temperature checks are something you can utilize. And nowadays, there's so many apps that exist out there. They're free apps. There's paid apps where you can do health checks. So they're like very specific set of questions. Say if someone's going to come in for Jummah prayer, on Friday, like time for Jummah, I'm not sure. Let me open my app and answer these questions. And if any of them is positive, the app automatically gives you an X, don't go, you may have COVID kind of thing. So you definitely want to utilize technology. Patterns, that's important. So if your mosque is a small or large, especially I think a small mosque, you would psychologically be a lot more concerned, and you'd probably be a lot more, okay, we got to make sure things are a certain way. I think traffic patterns are important for small mosques, but also large mosques, because large mosques is where we're going to let our guard down. I think place is large, we don't have to worry too much. That's the place you want to make sure that you have certain patterns. When people enter, they go in certain way. If you're going to utilize a wudu place, and everyone who should come to the mosque actually should have do wudu at their home and not at the mosque. You should limit as many people as possible from having wudu at the mosque. So the small number that haven't done wudu at home do wudu at the mosque. You can have a pattern.
Could they set up wudu stations potentially even outside? Because obviously not everyone can keep wudu all the time.
Of course. Traffic pattern is what you want to utilize. They go in one way, and then when they're done, go out the other way. And same thing with entering the area of prayer. It should be set in such a way so when people enter, they shouldn't be exiting the same way, because if you have people entering and exiting, that's going to put you at risk. So ideally, when you do enter, if it's possible, you should have different exit, different entrance. So you enter one way and then you exit the other way. Only if there's only one entrance, then have a system set where you limit as much interaction as possible amongst people. The seating design is something that's been utilized quite effectively in schools, but in mosques, same concept. Yeah, it's not desks or chairs, but the key thing is going to be where you're sitting for prayer. You want to make sure that each prayer area, if it's going to be individually, is set to 6 feet apart. The other big thing is you want to allow as much light in as possible. So, one thing I say, if you can, especially the weather changing, try to be outside as much as possible, to do, especially, prayers like Friday prayer, right? And I know it's going to get hot, but sunlight does play a really big role in killing the virus. So yes, you should have, when it gets super hot, tarps, but if you're able to allow sunlight in different methods you can come up with, just do know that it is known to inactivate and kill the virus within 15-20 minutes of exposure. So again, being outside with the sun is going to kill the virus. The other thing is it gives you a lot more space, a lot more room, and at the same time it allows you to have that distance. And if someone is infected, when they call for sneeze, the wind does play a big role. The chance of catching it could be limited. Next
I
thing,
just noticed, I think your battery is running low. I don't know if you have a plug.
oh, I do actually. Please, I do apologize. Let me quickly plug my laptop in. It's such a beautiful day outside, so I'm just enjoying it. Just give me 1 minute. Let me just go ahead and make adjustments. Thanks for letting me know, Zane.
Sure.
I'll be right back. I apologize.
No worries.
Okay, sorry about that. I'm back. Thank you, Zane, for that. So next step, right? Sanitation protocol and design. Just know that the COVID virus can survive on surfaces for up to 6 to 9 days. Depends on the surface, doorknob, cardboard, cans. It depends on what surface it is, but the average survival is 6 to 9 days. Hence, an extremely important reason as to why the most utilized areas, especially if you're going to utilize the wudu areas, they're cleaned consistently. That's very important. So, you want to have hand sanitizer set, of course, you have to be smart about it. You can put them in as many places as possible, or you can put them in the most high utilizable areas, but you want to have them very easily accessible. That's very important. The other big thing is make sure the hand sanitizers have at least 70% ethanol. Less than that, its ability to kill off the virus is quite limited. So if you're using, hand sanitizer, for example, that's ethanol is like kind of like 25% or 30%, then it's not really doing its job. Then you're gonna still be at risk of preventing spreading COVID itself. The other big thing, and I think people, who come to mosques and will be coming in with all these events, you got to make sure that everyone takes ownership. If someone is going to utilize, for example, wudu, right, you should have a area set up. When everything is utilized, it should be cleaned. So everyone who's there should take ownership and be responsible to make sure that all the areas are wiped as much as possible. So that's very important, I think, when you are going about opening up the mosques. The other big thing, you want to create a coordination team, right? So you're going to have a lot of these bubbles, right? So let's say there are, I'm going to say 40 people, right? And we're putting 10 people in each bubble, right? You want to have like one lead coordinator that's able to coordinate with all these bubbles, right? And if your bubbles are bigger, and I'm going to leave that to you guys, right? Your community, your community better than anyone else. You can consider having, if your bubble is going to be large, for example, one person in the bubble who's responsible for making sure they communicate with that person, and vice versa. And then each of these people communicate with one main person that communicates with the administration of the mosque, right? So one lead coordinator with support coordinators as needed. And I think if you're able to do that, you can make a very small specialized team that's able to keep track of everything. It's able to communicate when communication needs to be necessary. So I think that's very important. I utilize the word as champion. You got to have champions within the bubbles. Those that are willing to volunteer to be champions, staff, volunteers, and then one main champion for the entire mosque that's going to make sure that things are appropriately followed. These 8 steps that we have are appropriately followed. The other big thing, encouraging vaccinations, right? And this is so important. I just want to address it. It's very important. I think a lot of people do have this question. Are these vaccinations made of products that are haram? The answer is no, they're not. Especially the Pfizer, Moderna. Absolutely not. It's they don't even utilize aborted stem cells. And there's some, how do I put it? Some controversy behind like, oh, aborted stem cells, what does that even mean? That's like where J&J comes in. So I can say right now, Moderna and Pfizer are safe. Like there's no worry at all from that vaccine itself. The J&J vaccine, you will read up on it and you'll hear, oh, the J&J vaccine, comes from aborted fetal stem cells, for example, right? I looked into it, in 1985, there's actually two fetal stem cells we utilize, from quote unquote fetus. The J&J vaccine was made from a cell that was isolated from the eye, so a retinal stem cell from 1985. And we have the ability in today's world to be able to make these cells essentially be immortal. And they use the cell to see the efficacy, for example, of how it works. There are no cells, in the virus. That's very important to understand, and I'm sorry, in the vaccine. Very important to understand that. But just keep that in mind. And I think ultimately, if you're going to go any of the route and you're not sure, consult with your religious leader for the community. But, either or, when you go with risk versus benefit, right? The risk of not being vaccinated, is potentially spreading it to others and people dying. And I've lost count the number of people I've seen unfortunately pass away right in front of me due to this. And no, the viruses do not alter your DNA. And if anyone's concerned about it, I can talk to you about it. With something like mRNAs in your body, it's in your cells. Yes, but there's the way that's set up. It's impossible for it to get into your DNA. It's absolutely impossible. It's very difficult for something like this to get in. And just an FYI, I think I mentioned that my background is in cell biology, so I've done a lot of research in these things. So I do have a very good understanding of how mRNA technology works. So what's the benefit of being vaccinated? Like this is it. And I almost guarantee it, this is gonna eventually, you can do everything. But ultimately right now the CDC is saying, and as a physician, we've known this, that if you are vaccinated, you can be around other vaccinated people without masks, right? I think that's amazing, right? So if you're fully vaccinated, by definition, this is very important. Fully vaccinated means 2 weeks after the second dose of your Moderna or Pfizer vaccine. So you got your first dose, say today, your second dose is a month from now, which is 7 May, right? You're not vaccinated yet. You have to wait 2 weeks after, then your protection kicks in. And same thing, 2 weeks after getting the J&J vaccine. If you are not within that category and within that, if you don't fall in that definition, then you're not vaccinated fully. That's very important to understand. So a lot of people are like, oh, I just, I've seen very few people at this point. I've actually very few people that come in with COVID who had just gotten the vaccine, at the hospital. And the thing is, they're like, I just got vaccinated. I thought I was cured, and I was going around mixing with people. No, you're not. You just got your first shot. Some people got their first shot and we're mixing, and then some people got their second shot and we're mixing, and great thing for them. I still say the vaccines did their job because they're very high risk people and they ended up going home without having any issues. So I was very happy about that. So vaccines are doing what they're supposed to. So, the other thing you want to, the CDC is saying that if you're vaccinated and you're vaccinated, you go to someone else's place who is unvaccinated. The CDC says that you don't have to wear masks with them unless that person that you're visiting is high risk. People are like, oh, what falls into high risk category? Blood pressure, diabetes. Look, the way I say it, if you're taking a daily medication, unless it's for like allergies, like, a simple allergy medication, if you're taking a daily medication like blood pressure, diabetes, anything, then you almost always fall into that chronic category. So, if you're going to go, if you're going to think, oh, I'm going to go meet with someone who is not vaccinated, your parents, for example, if your parents are above a certain age, they're definitely high risk. You can eventually mix, and I expect the CDC to eventually tell us that we can mix, just like all the other viruses. I'm sorry, all the other vaccines we get, right? We get measles shots, mumps, rubella, and when we get exposed to measles, we don't sit there and go crazy, got to put masks on because we have enough data, right? With this, eventually, I believe, this is my opinion, very important. We'll have enough data for the CDC will say, now that if you're vaccinated, you can mix with anyone without any issues. But I think the guidelines are already pretty good, pretty laxed. So if you can get your community vaccinated, then you guys can mix without having to worry about all these special rules. So that's very important, and it's why you should be pushing to get vaccinated. There's so many avenues that are opening up, especially with President Biden's recent passage of his bill that there's a lot more support for the vaccination. So in your communities, if you don't have opportunities already, they should be opening up very soon. So I got this checklist from, there's a joint statement that's released. If you reach out to me, I can forward it to you also by the National Muslim Task Force. And if I sent you an invite through email, you have access to it. They do a pretty good job also talking about, what the general consensus is. But I thought this was a pretty good checklist I just put in. It's a great checklist, actually. I think you should take it and then readjust it according to your own way before opening, what you're doing when you're opening. Very important to make sure you have a very good plan and strategy on hand prior to opening. So, how can we help? We have a robust team of physicians, mid-level providers, and nurses, etc., that can help you revise an opening strategy. If you already have one, if you don't have one, we can help you come up with one. It's going to be at no cost. And then same thing with the weekly testing to bi-weekly testing. That's something we can also help with. And if you want to do, long-term projects with us, whatever you need, you can reach out to us at any time. And, and those that know me, if you have my cell phone, you can call, text me at any time. I'm always very responsive. And, let other places know also. There are methods, there are companies, there are schools that have opened. There are a couple of schools that we trained with, actually. Zain and I went and trained with in person that have been open since the beginning of the pandemic. When I said beginning, I'm talking about September, right? Schools closed and then school opened up again. And they've been open since September, and they've had 0% in-school transmission amongst their students. And yeah, they're private schools, and they have a lot of, one of the big things that they have besides a detailed plan was a physician on board that helped guide their opening. So I think that's very important. If you can have a very well-trained physician who has a pretty good understanding of how COVID is and have helped manage these, and just a physician who understands the guidelines can definitely help you open safely. I think that's it. That's about us. Do you guys have any questions, any concerns? I know it's quite a bit of information, but anyone wants to reach out, you can send me an email, you can give me a call, and I can work with you one-on-one to help you get a plan ready. Is there anyone with questions about anything, vaccinations, opening? Oh, it looks like somebody sent a message. Oh, okay, thank you. Okay, no questions. If there are no questions, then I'll go ahead and.
I think someone asked, how can they reach out to you? If you want to share your email or phone number in the chat.
Yep. So I can definitely do that. I don't see the chat thing right now, but you can email me dr period Manzoor Manzoor at safelyopen.org. Feel free to text me. I'm actually always available. My number is 732-595-8360. Feel free to call me. I think this is very important that we do it right, because a lot of us are getting, if we haven't already, COVID fatigue. New Jersey, if you look it up, is a hot state again, and being at the hospital at all times. Thank you for sharing that. Being at the hospital at all times, I can tell you, I myself experienced, because I'm part of the team that only takes care of COVID patients, in Central Jersey at one of the hospitals. Just a couple of weeks ago, we were so happy things are going down, and within a week spiked up again. So we have, a lot of us have COVID fatigue already. We're getting tired of being indoors all the time. We're getting more lackadaisical with this, and we can't stay closed forever. We want to open up. So I definitely encourage everyone to open up, and I am telling you, this could be done safely. Please utilize your your resources. There are physicians in a lot of communities. Reach out to them, reach out to me, see if I can reach out to them. If you have someone a physician in the community, I can speak with them, I can work with them, we can work with them to help you guys come up with your method, because we all know that you guys are going to open up. Let's do it safely, especially during the month of Ramadan. We don't want to be responsible for putting other people's lives at risk. And I am serious when I tell you, I've lost count the number of people that have lost their lives in front of me. COVID is not gone. It's not going away anytime soon. It's not until, we're all vaccinated to a good point that we can finally get back to normal, but we're getting there. We're close. And I think this is a very important step, especially with opening mosques and getting back to at least the religious life of things.
Thanks, Doctor. If we could just do a quick summary of like the key things to be aware of if they want to safely open, and that there is good news that with the vaccinations growing and the plan that you've created, that there is a way for people to get back together.
Very important to understand. I did not create this plan myself. I have very, very smart people, like I say geniuses, like Zain Ali himself, who's done a phenomenal job working with me to help create this plan. So just as an overview, this is very important. If there's one thing you can get out of this, out of all these, right? Testing is very important because up to 59% of people per the CDC can be asymptomatic. You got to have some sort of testing system set up, right? The other thing you got to do is when you let people into mosques, right? You have to know who's coming in and where they are, right? Social bubbles are going to be very important. Okay. And lastly, the third thing that I think is very important is vaccinations. I think those are big. But if to break it down, weekly testing, bubbles, that's very important. Doing as much as possible for social distancing, having areas and protocols set for constantly cleaning, and encouraging vaccinations.
I think the good news is that the schools that we've worked with and what we have seen is that if you implement this plan, the risk is basically gone, right? So if little kids can follow this plan and if they can be open, thousands of people coming and going for months on end, and there's no reason why we can't do this at our other places as well.
Yep.
And yes, ventilation is important. Absolutely. A lot of centers can't afford to upgrade the ventilation systems. I think the alternative, Doc, is to open windows or do it outside, right?
Yep. Open windows, get as much sunlight in as possible. Sunlight's your friend. And just on a side note, most of us in the Northeast, especially with the pandemic now, a lot of us deficient in vitamin D. I can almost guarantee most of us are because we don't get enough sun. So getting all that extra sunlight is going to be helpful. And vitamin D plays a very important role in helping build your immune system to fight off COVID infection, FYI. So
yes, maybe people can add a little bit of a vitamin D vitamin to each star.
All right, if there are no other questions, you have my contact information. You can reach out at any time.
Thank you.